So good evening, everybody. Today, you're welcome again for yet again a wonderful series, which is very unique. It's a webinar series to improve healthcare access for transgender and sexual minorities for the doctors by the doctors. And it is organized by the Raksha, Shakti and social wings of IRIA Kerala in association with IMA Kerala and the Center for Advanced Research in Human Behavior. This is a very unique session because we do not normally have this topic which is spoken of. And today is the fifth of the series because we are having an all-encompassing session. Each day we are touching upon various topics. So today we have a panel discussion which is talking about the role of healthcare institutions in the care of transgenders. Transgenders are basically, it's an umbrella term, and there is a lot of factors. There's a multifactorial thing. It has a lot of psychological, behavioral, physical, a lot of impact that is there in the society, economically. There's a lot of burden that occurs to these people. And so we are trying to touch base with each of these aspects. And today we have a wonderful panel discussion. And this panel discussion is going to be the moderator of this panel discussion will be Dr. Praveen G. Pai, will be the main person who is moderating the session. He is a geriatrician and public health specialist and the technical support unit of Kerala State AIDS Control Society. And the speakers of today would be Dr. S.K. Harikumar, CEO of Center for Advanced Research in Human Behavior. He is a medical doctor with more than 35 years of professional expertise in health program administration, management, capacity building, and strategic planning. Behavioral medicine is his area of work in which he handles technical issues related to behavior, sexuality, gender, mental health, and partnership building, which are the core issues on which he focuses. Work experience in medical treatment, medical teaching, research, and capacity building gives him wider perspectives to speculate health programs. He has worked in academic and professional organizations under government, state, and national board, and non-government organizations. Strategic planning in healthcare programs is one of the professional strengths of the designate of this project. Partnership building with PRIs in the state of Kerala in National AIDS Control Program in the state has been done under the eminent leadership of him, which resulted in unique partnership initiatives implemented in the state by different PRIs in NECP. Presently, he is the head of technical support unit of Kerala State AIDS Control Society and technical consultant to Kerala University of Health Sciences, that is KUHS, Thrissur and Child Development Center, and Government of Kerala, Trivandrum. So that is his very vast profile. That itself shows us that what level of panelists we are having. So the next panelist is Mr. Rajarajan sir. He is the Chief Operating Officer of MGM Healthcare, Chennai. He's a seasoned healthcare management professional, a visionary leader with a global perspective and strong business acumen. He has been leading various successful ventures in India and abroad, especially in areas of multi-specialty hospitals, oncology, cardiology, diagnostics, and health tech. He is a member of American College of Healthcare Executives, life member of Consortium of Accredited Healthcare Organization, the Research Foundation for Hospitals and Healthcare Administration, and Telemedicine Society of India. He has completed his Executive General Management Program from Indian Institute of Management, Trichy, and currently pursuing PG DMLE from National Law School of India, University, Bangalore. He has earlier completed his Masters in Health Service Management at Apollo Hospitals, Chennai, and Charles Sturt University, Australia, and MSc Psychology from University of Madras. He is the Industry Advisory Council member for NITTE, the School of Management at Bangalore, and visiting faculty at SRIHER, the Faculty of Management Studies, Chennai, and member of Board of Studies, BSc Health Informatics Management, ICFAI University, Tripura. He is also the member of Industry Institute Interactive Forum, Shankara Institute of Management Sciences, and Coimbatore. So that itself tells we have such eminent faculty amongst us. So looking forward for the discussion. Over to you, Praveen sir, Hari sir, and Rajarajan sir.
Thank you, Dr. Dr. Avani. Thank you for the introduction of the panelists. So first, I think let us hear from Rajarajan sir, whom we very well know that he's been an administrating head, is the CEO of many hospitals. So, sir, can you just enlighten on how healthcare system currently works in your perspective, what you have seen, and also how we can improve upon it, being more friendly to the diversities, even the sexual minorities or transgenders, and also how to be inclusive. What specific things can be done? What the deficiencies and voids are there? To you, sir.
Thank you, sir. First up, a very warm welcome to all my fellow panelists, moderator, and many of the state office bearers. It's such a pleasure being a part of this panel and discussing something which we all need to voice out and together take it forward. I would like to start with respect to when we talk of trans individuals and when we do talk of the LGBTQIA plus community. The inclusion aspects, in the community at large, and especially at a healthcare setting. What kind of specialized care that which we'll be requiring, which is being covered in this series by various luminaries over the days, and also with respect to the barriers that which they have in the healthcare system. It could be related to the access, the financial barriers, with respect to the discrimination or even the cultural competence which are there in many of the healthcare facilities where they go for their treatment or and also the systems, the health systems that which we'll be talking more so in the coming this thing, and the socio-economic barriers as well, which they are pushed to, and due to which they are finding it very difficult to access healthcare as well. So these are all, as you see, very interconnected, and so we are talking predominantly on the third gender and also of inclusion of all the other minority groups, and that's my initial comments. And over to Dr. Hari Kumar for his initial comments.
Doctor, please unmute.
Yeah.
Sorry. Thank you, Mr. Rajarajan, for your nice introduction on the issue which we are going to discuss this evening, and Dr. Avani for the introduction of the panelists, and Dr. Praveen for the facilitation. So, in fact, I quite agree with what my co-panelists started with, because there are a lot with the health system has to be prepared to receive the needy, and in that thing, actually, our LGBTQ community definitely is a eligible, needy, respectful community, which should be welcome to the healthcare system for them to be more comfortable and expressive on their needs, and for the system to understand more about the issues and also their behavior. So it is actually with the or judiciary and the governments which come up with the supportive attitude towards the this society or community groups. TGs, of course, is a group which is evidently coming up with issues, but this is in turn supporting the LGBTQIA population in many ways, because many of the issues are hidden. Many of the issues, as in our introduction, Dr. Avani told, it is not being discussed. People are not very confident and comfortable in discussing all the things like that. And once we start discussing about it, it is not only the gender-related issues, it is the general health issues. There are many peculiar, there are issues which are very specific for this community, especially we are working in the HIV sector, like vulnerability towards the HIV infection, STIs, and other definitely psychosomatic illnesses, mental health issues. So all these things are something which require very compassionate understanding, timely support, and also ongoing follow, for which there should be an excellent relationship which is built in the beginning and which should be followed up correctly. So it has also been found that actually, if you are going to provide this sort of if you are ready, if the health system is ready, then we need to equip our healthcare providers with at least a basic understanding about the requirements, the needs, those areas where we should be thoughtful and also careful. So there are issues where our people have to be empathetic, and for whatever being provided should be that what is going to be supporting and not in any way making them in difficulty. For that, what you have to have is actually there should be at least a basic understanding on behavior, sexuality, and also the basic interpersonal communications, the value of that, and the basic requirement of that. So this is the health-seeking perspective of this issue which we are discussing, and I think these are the two dimensions which we should be highlighting, and we'll move forward with the contribution from our participants also, from where definitely some valuable suggestions and guidance will come. This is all my introduction. Thank you.
Thank you, Hari Umar sir. My question is to Rajarajan sir. Can you throw some light on some of the specific points which the listeners can understand, specific points that a hospital or a healthcare institution can keep in mind so that they can be more inclusive and accepting the diversity?
Definitely. So I would like to start with the role of the L&D department, the Learning and Development department, the HR department, in sensitizing the teams to the third gender, and inclusion of that in all gender forms, even while they are registering, even while they have to, when we talk of all these consent forms, especially, we still see it is either a he or a she. Even when we go for a digital consent forms, we still don't see the trans individual pronouns very evidently over there. So this is something which hospitals can look out to see how they become inclusive. So it should start with the HR L&D, sensitizing the teams. It should flow into the forms for capturing the trans individual genders, the corresponding pronouns to be in place. It could even be as simple as the restroom access. As JCI accredited hospitals or NABH accredited hospitals, we have, even for differently abled people, we have a separate restroom. Now, there is a challenge with private healthcare institutions. Even though if the institution is inclusive, we are treating a lot of guests. We are treating a variety of guests who do accept the community, who might not be in acceptance to the community. So not as a discriminatory, but then the physically challenged or the differently abled restroom, that which is a individual restroom, should be also looked at for, the way we put the signage over there needs to change. And it should open out even for the transgender communities, the various other specific things. The ethics related aspects is also very, very important in this. We could even look into, the trans individuals participating in clinical research, the clinical ranges, the various sample population and the responses, the chemokinetics of things. So all these are going to be very important when it comes to ethics, or even when we go into the clinical research, because this population is a growing population and we need to acknowledge that. And as I started first, I would like to round back with HR and L&D, who would be sensitizing all the staff member on the staff attitude. In fact, how it can begin is by all of us opening the doors for the community people, the LGBTQIA community people, to come in and work with us as one amongst us. We will understand when they are co-workers, and we will be able to treat those community members better in the coming days. So this is a humble appeal that I would place on records to all those who are listening and who are going to listen further.
Sir, do you have any experience in employing, or you have been a major employer often? So do you have any experience in this line, in employing, or
Sir, in one of my other organization, we have utilized this community to spread cancer awareness. That video even got the award. It was shot in Bangalore. It is a very famous oncology company, wherein the trans individuals were utilized to spread awareness on breast cancer and stuff. But if you look at it as an employment in any of the organizations that I have worked, we have involved them in as contract employees for a short period of time, as apprentices for some work, but still we have not yet included them as part of the payroll, as far as I have seen in my in those organizations that I work. But something which I have been discussing with my HR team, because I would, we work a lot on the sustainability aspect, the people, planet, and the partnership and the profit, which would automatically come in. So in that, in the people part of it, the inclusivity, removing these disparities is going to be a very vital thing. So in the future, definitely we are looking to open the doors for the community, LGBTQIA community, to come and work with us, especially the transgender, trans individual community, to come and work with us.
Sir, actually, let us continue with the HR part only, which you were discussing. This question is actually to Harikumar sir also. One of you can answer, because the international journals and studies very well show that if you employ a transgender, the attrition rate is very low, and again they are more committed, and their work is comparatively better than others. Somehow that's what the literature says. I got one of the literature from the from the industry sites, but our experience in India, or in Kerala at least, it's opposite. Actually, I'm also surprised, and many of the employers are a bit reluctant to employ them also. Harikumar sir, can you throw some light on why this is why this paradox? Is it some behavior issue or something over here? So,
yeah, maybe it is not the behavior issue, but it is a behavior basis or what. It is just got a behavior basis. I won't say it is an issue. So what Dr. Praveen said is absolutely true. So our performance will be the best when everything is conducive. What I want to express, I should be able to express, and what I am expressing should be perceived, and it should be reciprocated, and it should be followed. So all these things are important. So this is what is the requirement of our gender as such. So our gender make us comprehend, express, then interact for everything. It is a gender base in us, with which we are actually doing the soft skills. So here, when someone is employed in a place, and if the gender is nurtured well, and if it is given an opportunity to get expressed to its optimum, definitely the productivity will be the best. But what happens is actually in most of the service situations and all, there are multiple places of, I should say that it is the cognitive threat or whatever it may be, the place where, see, or the person is not being perceived as I deserve to be. Because if you see our TG population or the members of the LGBTQI population, there are actually the way in which they are being received by others, the interactions which they are getting, the sort of confidence people put on them. So these things, there may be some aberrations. So these aberrations make them, in fact, it is not always, but in most of the situations, actually, the civil society is not mature enough to contain them with compassion, so that their expression and productivity will be the best. So I think we should have simultaneously a system for like facilitating their well-being, their their comfortable presence in the midst of the mob, and if those things are addressed well, we'll be able to gradually bring a change to the situation. But this is I don't find it is going to be very what it is against it is something which is opposite to what is being seen in other places. Actually, we are actually going through the process to reach the destination. We have started a little late, and so the present process is going to be difficult. That's all. In some places, it is they are doing extremely well. If you see the performance of our people, our community people in the things like our HIV program, they're extremely well accepted, and their community events. If someone comes and see, excellent, because it is that 12 hours. You don't know how it moves forward. So there are situations, and I have witnessed situations where the productivity and expressions are the best. So we have to make it happen by equipping ourselves also to enjoy it. That's what I feel.
Sir, please, please, sir, sir. Please
just
add on.
adding to that, sir.
Yeah.
Dr. Harikumar put it in a very nice, polished way, but, breaking down the myth with respect to it, the kind of discrimination that they could face in the workplace, the kind of discerning looks that they can get, and also the other bigger one, which we don't like to probably talk about, and we have a committee, a successful committee running in every hospital or every healthcare facility or even every company, the ICC committee, after the Posh and Vishaka related things. So the kind of harassment that they would be going through. See, these are all some of the major reasons for attrition in those companies. It's not just that the companies are ready to open the doors and have that inclusivity policy. That's why I go back to what I started with. The HR L&D teams have to sensitize. We need to start looking at those champions. Even when we do an NABH or JCI, we look forward to chapter champions and stuff. So we would need to identify in each of our companies or amidst each of our organizations, champions who will lead the cause, not especially members of the community, but also common people like us who come forward and would be flag bearers for such people. And when we stand together with them, they will gain strength. They would know that they are well supported, and they will, when we mentor them well, and when we give them a chance to perform, when we give them a cushion to say that, okay, you go forward, we are there to back you up. So that kind of a thing, when we say, and many companies, I'm sure, if you look at the list of great places to work in India, many of these companies have started employing the LGBTQIA communities, especially the trans individuals, and have been very successful in bringing the population, the cultural diversity in the organization to the fore, and which has also helped them to grow further and stuff. So 3 major cornerstones which we need to, transform: the discerning looks, the harassment, and the disparity that which one could be showing towards trans individuals.
Yeah, I think it is correct. If everything goes right, and if everybody gets an equal opportunity to perform, probably they may also perform the same way or even more, because the experience what Harikumar sir shared, his experience with the community events and engaging with transgenders and the LGBTQI community, he feels they are much more, talented and expressive than national research also towards that. And Rajarajan sir, as you said, the main thing would be training and the HR when it comes to administration or employability and employment and all those stuff. Apart from the infrastructural thing we will come to a bit later on. But let me ask Harikumar sir, do we have any set training modules or something like that? Because it's a very vast field. If you're going to talk about it, it's like a story. Do we have something set which we can take to each hospital, sir?
In fact, actually, interestingly, recently we have done, the organization has done a participatory need assessment with the community. And most of the pillars were built by the community themselves. So it has been, actually the draft, actually there are two things which we developed. One is actually a module, a package with which we are going to skill build the community. Second thing is actually an advocacy package, which is complementary to this skill building package, which will be used in various sectors. Like if we take the hospital, government offices, then other like civil society, political parties. So all these places, we need something like a effective advocacy package, which is going to be led by the community. There will be a community champion who is going to lead it, and will be backing. So once that is done and this skill building is provided the way they want it, especially the soft skills and actually the comprehension things and this monitoring of these issues which they are having. So this is some, and this was interesting that we did what is called this anonymous response analysis for them to come with their views and then to respond how to shape it up into something like a capacity building package. It has not been completed, but we are in the process, and maybe in another couple of months we'll be ready with the thing. We do have a lot of packages. Actually, the NACO and the other organizations, development organizations do have a lot of packages pertaining to the various thematic areas like sexuality, then IPC, things like that. But here it is actually they're guiding them to win over each segment, each sector, like hospital places, education institutions, government offices, and all. Their requirement was they said that this is going to be their primary requirement to compete or interact successfully with the existing systems and personalities.
Sir, so a nutshell, it would be we need to have a good training for the HR, even the doctors, the nurses, all the staff in the healthcare system related to the healthcare system, including the management, has to be sensitized. Then only the institution itself will be like all inclusive. Sir, Rajarajan sir, can you point out some of the specific things like we initially started? You were telling about the forms and bathrooms issues. Can you elaborate that on, sir, so that we can have a checklist sort of thing
Yes.
we can anticipate?
Any hospital currently, we like it to be a patient-friendly hospital. So when we design a patient-friendly hospital, we take into consideration a lot of aspects based on the population dynamics, the various people, the adults, the pediatric, the geriatric. If you look at even in the restrooms, the holding bars and the pull cords, they've all become a normal standardized thing in every hospital currently. So these are all things which has been done for making it a friendly hospital. Like now, as a hospital, when somebody gets registered in the hospital, we send message. As a hospital, when they fill the form or get a service, we even send the bill as a WhatsApp. So all these are many things that which we are doing to become a patient-friendly hospital. And now it is time we also acknowledge the LGBTQIA plus community and see how we start looking into those aspects. Say, for example, as simple as when a patient is coming to fill the registration form of the hospital, be it online or be it a paper pencil form. When it comes to the gender, do we still have a thing for the third gender individuals, trans individuals? We still don't have. Like 99% of the healthcare facility, be it a government facility or a private facility, we still don't have. We have not yet incorporated all this into our HIS systems. See, this is very important because when say a trans individual is coming to do a laboratory test, their clinical range should be viewed at a different way. You know, I have medical people, you would all know better than me, but then the clinical biological range that which we say for many of the this thing, say those things are going to differ. So right at the beginning, capturing the gender of these trans individuals is going to be important. This inclusion is going to be of greater help in continuing the treatment and stuff. You know, we've been seeing in this series itself, you know, we saw the importance of counseling therapy. We saw about hormonal therapy. We did talk about, you know, in various other medical forums about the gender affirmation surgeries and all the stuff. But again, in all these consent forms, it's still the male and female related aspects which are listed. And we have not yet opened out to this inclusion in this. Though the government is talking and through law, it has brought in, you know, a lot of focus onto this trans individuals. We as individuals, as organizations, as, you know, confederation of various companies and various bodies, we need to bring all this in. I did say earlier that even for an NABH or a JCI, I do have to show a special restroom, how I have for physically challenged people. And as hospital also, I may be showing a room for smoking, a smoking room with a chimney. Now, how do I include this LGBTQIA plus community, especially the trans individuals? Now, when they come, as I said, there is a challenge with private healthcare institutions. Their acceptance, say, for example, it's a trans individual female person, their acceptance when they enter the restroom of females. So this is a big thing for each of us to think. How do we include them in such instances? It's not that as organizations we don't want to, but how would our other guests perceive it? You know, Harikumar sir beautifully put it before. It's also the community's inclusion, you know, how they respond to, even if we open the doors to. So that aspect, that's one of the reasons why I said, you know, the ready-made solution that we have is, we have independent restroom for the differently abled people. So maybe we should no more call this as a differently abled one, but with a different name for people who can use this, so that we can start having them also come to us and stuff. Today, when we look at, you know, those people can be involved with a variety of functionalities in hospitals. See, post-COVID, I definitely see an opportunity for them to be employed with minimum wages, standing and measuring the temperature of all the people who are entering and putting the tags to identify patients, attendants, vulnerable patients, and all the stuff as and when they enter the hospital. This can be done. You know, there is a lot of way we as healthcare organizations can bring inclusion into the perspective, can even employ them, can sensitize even the general public that we are LGBTQIA plus friendly. You know, many hospitals or many clinics do put us, you know, find us on Google and all those Google pointers and all those stuff. Now, how many hospitals, how many places would start putting, We are LGBTQIA plus community. In Western countries, say for example, we talk of Philadelphia. Philadelphia, there is a system where you would know that it is a LGBTQIA welcome pubs and bars. Even before you enter, there is a clear-cut rainbow sign just outside and stuff. There is definitely a need for each of our systems to acknowledge their presence and include them in our daily day-to-day activities, to create a space for them. Because still, as I said, there is a stigma in the community. So we need to create that space for them. And this is not to discriminate them, this is to protect them. This is to ensure that everything happens in a smooth way. Even though as hospitals we do provide treatment, what is happening across the country, wherein the medical doctors and the facilities have been broken and attacked and stuff. Now, one of the last things that I would want is for such a thing to happen, that a normal guest of the hospital is not okay with a trans individual having access into the same restroom area, and would create an furore and uproar about it. So for us to protect the community, we need to create that space inside the hospital, which is not a discrimination, but giving them the space, giving them the respect, and allowing the community to be, and allowing the community also to mature over a period. Over to you, sir.
Yeah, valid point, sir. Valid point. Actually, regarding the bathroom stuff, we can have unisex toilets, toilet, ladies, gents, and unisex. So in a unisex toilet, anybody can get in without any issue. Sir, probably we can have in our trainings, whenever we have a staff training, we can have one of the transgender or the LGBTQ community.
Yes, sir, it has to be a part of the induction of any employee into the hospital. And it should also be, displayed outside the hospital. As I said, this hospital also, opens the door and welcomes
to come and talk to the people, talk to the staff. There was a problem with my voice. What I was suggesting was, is it possible to have a speaker from the community side, a transgender coming to speak about what they face and how they feel when they come to a hospital setting? That would give more insight to the staff also, how they feel. What do you think? Is there any such thing happening with JCI or NABH training?
Not specifically with JCI NABH. JCI NABH just
Rajarajan, sir?
Yeah. Nothing specific with respect to JCI and NABH. They all prescribe inclusiveness and stuff. But what you did say about the trans individuals coming and sensitizing the hospital staff and people, that's more on the design thinking concept, which is one of my favorite areas as well. This is an experiment which every hospital or every healthcare organization can look at, and hearing it out, like say for example, how we have the feedback from the customers. We can do a focus group meeting with the trans individual community, with the LGBTQIA plus community, to hear them out. What are all the social stigma, or what are all the barriers that they are facing? We did list a lot of those barriers earlier, but especially coming from them, we will get to understand the specifics. Now, when we get to the specifics, learned legends like you or even Dr. Hari Kumar and other doyens who are attending this program could come up with a nice charter how we can overcome these barriers in healthcare settings to include them as well.
Hari Kumar, sir, can you add on to what Rajajan sir told about the positive speaking? Positive speaking and what our experience with HIV stigma.
I was just like remembering that only. Actually, I remember that that's an excellent example of the Kerala experience we had. Almost, I think we started it in the year 2002 or 2003. That time, when HIV positivity was not, it was a threat. Many people were finding it, they were perceiving it as a fearful or dreaded disease. And at that point, what we did was actually we had a large number of prevention projects. In every prevention project, Kerala, for the first time, we started assigning one HIV positive person as a positive speaker. The positive speaker started coming and demonstrating in the midst of general public that I can do a lot of things, like I can do this sort of health promotion. I can do this identification of risk population. I can support them in ensuring prevention. So this became, and also then he said that I am also positive. So this actually helped the Kerala civil society to accept HIV positive population as one among them in the Mission Society. And now I know that many of our people whom we appointed as positive speakers at this point of time is now regular workers in the prevention projects. So like that. So I am trying to say that actually when the community is going to be engaged, they should be engaged not only, it should not be on any focused responsibilities, whichever responsibility they enjoy, whichever responsibility they have skills to perform well. So those are the things which we should be engaging them, and then we should be learning actually going to understand the result and then make the modifications. And again, actually inclusivity, actually bring them in the not only in the health premise. In the health premise, there are actually I support the proposal of this gender-specific documentation which Rajan has introduced. That's an excellent thing. Actually, when it is going to be gender-specific documentation, we have a lot of areas like in the emotional dimensions and also in some of the even biochemical dimensions and all, where we need to have a specific differences which is to be documented for the transgender population and also for the other people, other spectrum of the people. So, and also in the coming time, there will be other areas of many investigations and also the sort of hospital records, the discharge summaries and all should have some sort of a space where these things are going to be documented without having any discrimination or bias on the thing. So, and also there is a issue of self-stigma also to many of our populations, because they are fearful that actually if I am going to be expressive on my true gender concept and also my desire, I may not be getting due consideration in most of the places. So this will be alleviated if we are going to make the space more friendly and something like this gender sensitized. All the areas is made gender sensitized. That's it, Praveen.
Yeah, thank you, sir. Actually, so as you said, it would be of great help if we can understand and listen to their issues and their concerns directly while in training. But many times in our discussion, people find them as a threat, as abusive people, not so good people, who cannot be considered good. So these misconceptions can be tied over through such an interaction. Through such an interaction where we can understand what they actually go through and why they behave so, and what is the reason behind. Probably they're rebellious just because the circumstance is like that. They have to fight against their family, they have to fight against the society, fight against their colleagues, fight in their classrooms, teachers, and that's how they came out. currently in the current society. So that could be one reason. But before we go to the last part, Dr. Harikumar, can we have some insight on the legal perspective regarding transgenders, which a doctor or a management specialist or a hospital management should understand? The legal perspectives related to transgender, whatever.
See, there are with our thing actually there are two acts. One is actually the HIV Prevention Act of 2017, and also the Supreme Court directives on 2014. So the first one, the directives say that actually in the name of this gender, like transgenders should not be discriminated at any point of time, like in employment or in providing healthcare, education. So whichever is the scenario, they should be given equal opportunity, and also any attempt to discriminate them will be dealt with as a things to be corrected. And in this HIV Prevention Act also is protecting them. Actually, this is the group is considered a vulnerable population for this thing, and all the privileges which is given to the vulnerable population is also accessible to them. So in health and also this other social support initiatives, we are having a lot of provisions for our transgender community, and all this actually this LGBT community as such, all the 7 groups are not getting all the protection assured. For example, gay population are not getting some of the privileges that are going to be given to the transgender population. That is very actually some social protection support which is recommended for the transgender population is exclusively for the transgender population, and it is not enjoyed by lesbian or gay population. So here mainly actually the equal opportunities and the equal rights. That is the area at every point of time, every health social segment, they are having right to access and enjoy opportunities and also the services which is available.
Thank you, Harikumar sir. So actually, hospitals may be also liable for the staff actions. Probably, someday. I don't know whether the rules are in place. The act is in place anyway, that we know, and the act is pretty strong, and definitely the rules also will be stronger to protect them. So hospitals need to be sensitized, and the hospital management also should be trained on the implications of being diverse, not only being in a policy in paper, but at the same time in practice also. So that is one thing. And hospital attacks are one another thing which was brought out earlier by sir also. Hospital attacks are going in a tangent, in a very different direction. And one reason, and this could be also a reason for hospital attack for many, we won't be able to contain it also. So we need policies, training, implicitly saying that our hospital or the institution is open for all. It's inclusive. And doctors also should understand what a transgender is in their clinical practice, their processes, everything. So before we conclude, can we have the final remarks of each of the speakers before I could summarize it? Over to you, Harikumar sir, to start with.
Yeah, actually, since we are focusing more on the healthcare settings, this is important. Actually, the healthcare providers should have basic understanding on the sexuality and the gender dynamics, sexuality dynamics and also gender dynamics, and which are the places where privacy and respect for own decision, or like the individual's decision and choices are to be given. So that is the major thing. So once that is practiced well, and if there are many situations, there are many healthcare providers who believe that gender is something which is physically visible. where we all know that actually the gender is one which is actually more with the emotional dimension, which should be the basic understanding of every healthcare provider. And this leads to a lot of confusions about among the in healthcare settings. So, and also what are the things? So which are the do's and don'ts with a member of LGBTQ community? How to respect their status, the sexuality, the sexual orientation, as well as the gender status, and how to nurture it the way it is not going to hurt them. So that so these are the things which not to be told but to be practiced. So once such a practice comes, the person who comes to you, whichever segment of the LGBTQ community belongs, they'll start expressing it well. Most of the places actually what we hear from them is actually we are not able to express with the fear that actually we are not sure whether the people to whom we are going to express will understand it properly or not. So this basic things, because if we all remember actually the medical course which we studied, that time there was not a proper orientation on these two aspects. So which now is to be provided as an add-on, very simple CME or other type of learning, so that our medical practitioners as well as the healthcare providers in general in an institution will be able to provide excellent support. The study which I was referring, which we did in Ernakulam among the LGBTQ community. So there, one response was very interesting. That actually they said that we appreciate that at least the doctors now started understanding it as better, but the paramedical staff, the support and the sort of dealings from their side is something which still we are finding it very uncomfortable. So as Dr. Praveen has raised, we should have a system. Actually, I don't think that it is impossible. We'll be able to achieve it, but we have to move systematically with definite plan, with the support and guidance of the community members also. Everywhere there should be community presence. This planning, implementation, monitoring. Everywhere we need the community members to be part of our team to take this capacity building and advocacy forwards, so that we'll be able to ensure a gender sensitized and supported healthcare system in our country and the state. Thank you.
Thank you, Harikumar sir, and the great work you are doing for the state, and also with the NGO you are running, CARB. A lot of work happening in Kerala for sure, and we'll be able to share it with the rest of the country too after the studies are all published. Rajarajan sir, can you please give your final remarks? Probably to summarize from your side as a healthcare, administration management side. Thank you, sir.
Yeah, so a lot has been discussed, a very insightful session. We did discuss about what are the things that healthcare institutions need to do to educate, to sensitize, to include, and to respect, and to also provide space for such members, the trans individuals, and also the LGBTQIA+ community at large. We are all mere humans, and we always look up to heroes. We create heroes, and be it fantasy heroes like Marvels, or even the real life sporting heroes, or the real life military heroes that we have. There are some flag bearers in the medical community who are from the very trans individual community. I would like to talk about two such heroes, which is an appeal for all of you to even reach out to them, follow them on Twitter, and see the kind of initiatives that they are taking, which would be a real good example for all of us to imbibe and see how we can bring an inclusion in. So one of the first names that I would like to pick is about Dr. Aksa Sheikh. She's a professor of community medicine at Hamdard Medical College, and wonderful work that which is being done by her. And another name that I would like to pick as a hero is Dr. Samira Jahagirdar. She's a doctor of anesthesia and critical care consultant. She's ex-JIPMER and now in UK with the NHS and stuff. So amazing people who are standing up and voicing for the trans individuals from inside the healthcare community. We need to start hearing out their voices. And each of us as individuals have become a little more sensitive to this topic, a little more knowledgeful to this topic. Thanks to Dr. Harikumar for his amazing information that he had provided us, and thanks also to Dr. Praveen. Thanks to all the bodies who have come together, MedPiper, the IRIA, and the various other bodies. It's my pleasure being here. Thank you.
Thank you, Rajarajan sir. It was quite motivating towards the end. And again, thanks for bringing up like heroes like Samira Jahangir. I have heard her a lot. You know, the way a medical student had to face throughout the studies, then after that, joining a hospital, what all she had to go through. Even though being inside the system, she's an insider. She's a doctor by herself. Being a doctor itself, facing such an issue within a hospital premise, then there is long way to go. We have a long way to go before we can say we are all inclusive and what we can do. So let me just summarize some of the points which I quickly got in my mind. The first thing would be something we had to do with the infrastructure, which JCI or NABH, they have got excellent system. And if you are doing a universal design, then a universal design will be friendly for all, like all genders. It should be inclusive. Probably bathrooms and all those things need to be something special. But otherwise, what good point which Rarayan sir brought in was about the HIS, the Hospital Information System, which has to be more sensitive. And not only the electronic records, even physical records also, like updating the forms which we have, which do not have the third gender or transgender, or whether to mention gender at all. Then another point was schedule and in-service training for the staff. And then trying to bring in transgender people also to share some experience so that they can be more inclusive. Then another would be written materials and education materials, information materials, which are more sensitive. There can be pamphlets available both for sexual orientation and gender identity. And we can also gather some pamphlets which will be useful for co-workers. That would be also of great use. Then add gender identity to your agency as a non-discriminatory policy. That is another point which was brought in. It was said that the hospital or the institution should be able to declare that we are friendly to all genders. It's not just the cisgender, the men or women or transgender. It's a spectrum. In the other series, we have already heard it's not just 2 or 3. It's a spectrum of gender diversity which is there. So including all of them in a non-discriminatory policy, and to add that to the the umbrella concept will be more important. So we have to start from that. And another would be to create a resource sheet, then educating ourselves and educating the doctors to make realistic plans and all. Then, of course, recognizing that working to provide transgender friendly care will also improve the quality of care for all the clients. If we can, these are the major points which we have spoken about. And definitely Harikumar sir had brought in few legal points too, and also how important it is to have standard modules which are evidence-based modules which can be taken up for training, and how his organization has been helpful in bringing all this out. Probably we can have a trans-cultural workshops which is required, because in Tamil Nadu or in Andhra Pradesh or in Northeast, it may be different. The concepts and the way the perception will be different. So we need to have trans-cultural dialogues also happening. So it's a vast topic, and we thank all the panelists also. I'm sure there will be someone to thank officially, but it was a great pleasure to moderate this event. Thank you all, and over to Soumya, or the leader for further deliberations.
Thank you so much, Dr. Praveen. So I'm assuming there was something in the chat box. Okay, that is Rajarajan sir has put in the names also there. Okay, thank you. That was very nice of you. I was listening to the conversation and the discussion because everybody was so passionate about the discussion, about the cause that they're talking. So it was very interesting because many things we have probably not even thought in that perspective. We just take things so literally as things come so easily for us. We don't really see their perspective or understand what they might be going through. So it has shed a lot of light on that kind of a perspective also. And definitely it's eye-opening for all of us, and it helps us understand them and reach out to them more. So it was a very enlightening session, definitely. So first of all, I would really like to thank our panelists, Dr. Harikumar sir, Rajarajan sir, and Dr. Praveen sir for moderating the session. It was a wonderful session. I'm sure for all the listeners and for all the people who are going to listen to it after the recorded session, it's going to be really wonderful. I thank everybody on the panel. I thank our IRIA and IMA team because of they taking up such a unique topic, which is so unique and so needed at this moment. And I really thank and congratulate them for taking up this topic. I thank our team, which is there with us, especially the Soumya, who's been driving us throughout behind it. So the MedPiper team, thank you so much for providing us with the platform. And thank you, the listeners, because it is because you find it useful that we can do such talks that is going to reach out to you. So thank you so much for that. So I thank everybody in the end on behalf of IRI and IMA and Praveen sir. So if nothing more to conclude, shall we wrap the session? Shall we wrap the session, sir?
Sure,
Okay.
Ravani. Thanks a lot.
Thank you all.
Thank you, sir. Thank you, everybody.
Thank you.